rules I'll give you for this. Number one, you must find a statistician. Do you have a statistician?
We have, sir, in
You
our
have, good.
college.
The second is he should be involved very early in your study. Can you understand what I'm saying? Most of us tend to go to the statistician at the end when you have the data. Okay. So most of the statisticians, mind you, don't understand as much of medicine as you do. They are absolutely hopeless and helpless if you go at the end. So that's the second rule. The third is you should have very clear objectives in the study. Let me give you an instance. Let's take Vishnu's study. He's doing voice analysis and in adenotonsillectomy. Okay. Now, the statistician can calculate the sample size only on one primary outcome. You understood? He may be studying many things in voice analysis. He may be studying jitters, shimmer, he may be studying subjective, etc., etc. You cannot make a one statistics for everything. So beforehand only he has to say subjective analysis is the basis on which I decide my sample. So that the sample will be decided on the basis of a previous paper on subjective analysis. Then the statistician can help you with the statistical analysis whether your study has proved or disproved the null hypothesis. Am I making sense to you?
Yes, sir.
Right? Just again, I repeat, there are multiple parameters in any study. He could be looking at basal metabolic rate. He could be looking at obstructive sleep apnea. He could be looking at voice in terms of phonatory duration. He could be looking at a wide variety of things. Each one of them have different statistical connotations. So your primary outcome has been defined very early. So in your thesis, you define what is the primary outcome. And that will have defined statistical parameters. If you share offline, I can guide you. But if you have a statistician, don't go to the statistician and throw data at him. You go and tell the statistician very clearly, is this group? So now I'd like to ask you, what is your thesis topic?
So mine is the effect of personality trait on voice.
Fine. So you go to the statistician and you ask him very specific, which of the parameters of voice you are correlating with personality. That is your primary outcome. You got me, no?
Yes, sir.
Right? And then you can go to secondary outcomes because the primary outcome is the one on which your null hypothesis is based. Your null hypothesis is there is no effect of personality trait, but not on voice in general because that has no meaning. On one aspect of voice, and what that is something which will come out in your thesis. You need to. I mean, you can discuss that offline with me. Through your professor, and be happy to advise. Is that clear?
Yes, sir.
Yeah.
Thank you, sir.
Superb, Professor Ravi. May I next have Dr. Aisha?
You're welcome to counter questions. Huh?
Good morning.
Morning.
My question is, what are the
Aisha, where are you from and what level you are?
good morning, sir. I am Aisha. I am second year postgraduate. I'm from Bangalore.
Okay.
My question is, what are the different ways for easier interpretation of data that is collected at the end of the study? How
Okay.
do you?
Okay. So take all my advice to the others also into consideration. That is,
Okay.
you need to have involved the statistician by now. I hope you have done that.
Yes, sir.
Okay. The second is start with what they call an interim analysis. That is, I know we tend to analyze at the end of the study, but specifically I'm suggesting to you At this stage of study, you're in the second year, correct?
Yes.
At this stage of the study, you should do an analysis.
Okay.
Now, what you basically do the analysis, you divide your results into demographics. That means how many males, how many females. Now, I know you're not finished your data accumulation. So maybe your sample size was, say, 40 and you have only 10 or 15. It doesn't matter. You divide into male and female, age, etc. You start making your tables now. Tables. Huh? Don't go to analysis interpretation. Right now, you tabulate your results. You, you like, sorry, again, you'll have to tell me a thesis topic.
My thesis topic is combined effect of omega-3 fatty acid and methylcobalamin on sensory neural hearing loss.
So it's a prospective study or
Yes, sir.
cross-section?
It's a prospective study.
Okay. Fair enough. So, so anyway, so you need to start making tables. Now the tables are made on two. One is, of course, what you have stated as your aim and your objectives. Actually, are you aware of the difference between aim and objective? I'm not quizzing you. I'm just asking you. Do you have a clear idea what is an aim and what is an objective?
Not very sure.
Okay, so when you say aim, it is a general statement that you are trying to find out if omega-3 fatty acid helps patients with hearing loss. Okay, that is an aim. The objective is how you propose to achieve that aim. So you'll propose to achieve it by doing pure tone audiometry, by doing specialized test of hearing loss, by doing autoacoustic emissions, by doing BERA, whatever are the ways you're going to do it should be listed in the objective. So one result table is every line in the objective should have one table. The next table is what you have found out from literature. So suppose in literature they say that it has hearing loss has been related to visual acuity, hearing loss has been related to HbA1c, whatever. Each one of that should be one table. Are you understanding?
Yes.
So you make a series of tables. One is demographics, the other is as per each of your objectives, and third is as per the literature search on results. Then you talk about interpretation. Now, interpretation is to see whether there are associations one with the other. Okay, so you have various statistical tests like hazards ratio, etc., etc. That you let the statistician decide as to what is the best applicable, because it depends on the type of data you collected, etc., etc., which you know. I mean, done your basic statistics, type of data alters the test which you're applying. So go back to him and say, look, this is the data, what test applies. But what is more important is how you present the result. So you can say that in this confidence limit, with this power of the study, I am able to state that with so many samples in my study, omega fatty acid had an effect or did not have an effect. Now, this you do in your interim analysis and present it to your department. Immediately, Dr. Devan and the other senior faculty will say, you should have done this, you should do this, you should do that. If you don't do it now and you do it at the end, it will be too late. Okay,
Yes.
is that clear?
Yes.
Okay,
Thank you, sir.
thank you, Vidya.
Wonderful. May I have Dr. Panchami, please? Dr. Panchami,
Sir, they have that ACLS, CLS class.
what is that?
ACLS, CLS class, sir.
Yes, 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 yes. I
Anushree
will,
and Panchami.
yeah, I will therefore go on to Dr. Anushree.
Anushree is also gone for the class.
Fine. Just see if they are back by the time we finish this program. Now, may I have Dr. Abhinandan?
Good morning, sir. I am Abhinandan, first year postgraduate, sir.
Okay.
My question is how thesis helps in developing new treatment modalities, sir.
Okay. Abhinandan, where are you from? Where are you from?
I am from Mangalore, sir.
You're from Mangalore. Okay,
Yes,
so
sir.
actually, this question is a fascinating question.
Yes.
And I would start off by apologizing because the teaching community has actually not addressed this correctly in India and in extension the world. See, at one time, studies was very uncommon in India. People were just operating, treating. So the thesis was initially made so that the students would learn how to do research and then to make them clinician researchers in their life, because most of us are waiting for Americans to tell us solutions or the West to tell us solutions. Say, like for instance, if you have diseases like rhinosporidiosis, the Britishers and the Americans don't have that disease. But we don't have a clear cut treatment because we, though we have the expertise, we don't think of making practical benefit of our studies.
Yes, sir.
So if you have learned how to do a thesis correctly, you will often be in the future a good researcher. So the purpose of the thesis is basically to learn how to do a study.
Okay.
Along the way, this thesis became an imposition, it became a burden, it became a stick with which they were beating students, topics became repetitive, and a lot of bad things started happening with the thesis. In at the professorial level, what we need to do is stitch theses together so that, say, various aspects. So let's say you have COVID, all aspects of COVID can be stitched together with various theses and can be put together as a good monograph. But from your point of view, to the question, how does thesis help in developing treatment modalities? It can't help in developing treatment modalities unless it has been chosen with that idea in mind. You know that you should actually go and tell your uh, professor that this is what I want, and most likely he will tell you don't go there, because if you go into treatment modalities, you are going into a clinical trial kind of model. A clinical trial is generally unsafe
Hello.
for postgraduates. Can you hear
Can you
me?
ask those others questions,
Yes,
Amrita?
I can.
Then
Yes.
Yeah. So, what you
Panchami and
approach
Anushree.
thesis is,
I'll call you now.
what are the tricks of the trade you can learn, figure out how easy it is to do research, and keep
Yes.
your interest alive.
Okay, sir.
Now, the only secret is actually to be honest in your collection of data, because a
Okay.
lot of people can help you if you have honest data. I think at
Okay.
the end, if Professor Devan will permit me, I'll give you a small 5-minute talk on how to approach thesis. But for the
Okay.
time being, can it help? Yes, it can help. Should you choose a topic with new treatment modalities, I personally would advise you to be cautious, because if you go into clinical trial setting, there are legal implications, there are ethical implications, there are a lot of issues, and generally the boards are not very happy with this kind of new treatment modalities. They would
Okay.
prefer that you do simpler ones so that you learn how to do it.
Okay,
Okay,
sir.
you understand? So,
Okay, sir.
like, I
Yes,
may
sir.
want to do new surgery, but as a first year PG, people learn the old surgery first, master it, and then put in something new.
Okay, sir. Okay, sir. Okay,
Fascinating,
sir. Thank you,
fascinating.
sir.
And
Thank you.
I
Thank you very
now
much, sir.
my other postgraduates who are elsewhere occupied have submitted their questions which they wanted to be answered, and I call
Okay,
on Dr. Vidya to ask Dr. Amrita's question.
okay.
Good morning, sir. This is a question on behalf of Amrita.
Mhm.
Her question is, what are the recent COVID research related research projects at present, sir?
Okay, so um, see, this is a very vast question. Because if you were to go random to Google or to PubMed and type in COVID related research projects, they're close to, it's running into thousands, 10,000s of research projects all over on all subjects. See, it ranges from the virus, immunity to the virus, clinical course, treatments, outcomes, delayed effects, economics, etc., etc. There are so many topics which come into that. But, and also remember, every journal now has accelerated publications on COVID. So if you are interested, Amrita, just Google and you will find 1.5 million. But if the question is what study on COVID you can do or anybody can do among the audience present, what you need to do is first and foremost Google or PubMed or whatever search engine for ENT specialty papers on COVID. Second, see whether you have access for funds. And if you have access for funds, then it thinks life becomes easy. The third thing which you have to see is, do you have access to patients? If you have access to patients, please look around other departments. For instance, if you have access to patients, the physicians, microbiologists, pathologists, radiologists, all of them would like to do researches with you because everybody now is aware of COVID. Many people are sitting on funds, but they don't have access to patients. So I repeat, look at specialty papers on COVID, you will get ideas. If you have access to funds or access to patients, life becomes very much easier. You can choose your topic depending on which department you have linked with. And lastly, if you have nothing and you want to look at research projects, try to publish review articles. For instance, if I'm the editor of a journal and I get an article from you saying, review article on current status of smell research in COVID, I would be very interested in reading it. Okay?
Excellent, excellent. Dr. Vidya, can you ask Panchami's question?
Yes, sir. Yes, sir. This is a question on behalf of Panchami, sir.
Yeah.
What are the recent advances in ENT?
Okay, so this is another, interesting, fascinating, and vast thing. So let me first break it down like this. ENT has many branches. See, at one time, IENT was a specialty. The only link between eye and ENT was the nasolacrimal duct. Now, if you look at it, the only relation between the nose and the ear is the eustachian tube. Otherwise, they have different diseases, different pathologies, different surgeries. So actually, broadly, E, N, and T can be treated as separate subspecialties. Now, within the E of the ear itself, there are middle ear, external ear, that is pinaplasties, there is skull-base surgery, there is temporal bone surgeries. So there is cochlear implants, there's middle ear implants. So there are multiple specializations which have developed. And each one of them have their own advances. So if you have to sit and list, it really would not make much of sense. Similarly, nose, you can have ranging from allergy to rhinoplasty, to endoscopy, to minimal endoscopy, to skull-base surgery. In throat, you have in the oral cavity, you can have silent endoscopy. There is 1.5 million new areas, and each one of them has a recent advance. So let me put it to you slightly differently. Recent advances in ENT is important not because it is an exam question, but because what is today's recent advance may and will be the routine of tomorrow. So let us assume robotic is a recent advance. Sometime in the future, robotics is going to be the routine. So it is very important for you as a postgraduate not to focus on what your senior people do, but to focus on the recent advance and see what is being done there, because this is the one way in which you can succeed early in life. How do you do it? You look at one thing which you can do without stress. Say, for instance, you're not the surgical type. Then you look for recent advances in allergy, recent advances in medical ENT. Let us assume you are the type who handles the microscope very well. Then you look at recent advances in otology. Let us assume you're one of those who is a general surgeon by nature. Look head and neck. This you make your USP. You can also look at which area you want to practice. So let us assume you want to practice in a part of India where autosclerosis is very common. Then you can choose that, focus on that, and look for recent advances in that. So that becomes your USP. And focus on recent advances in that area. So I repeat, recent advances can be many depending on which sub-branch of ENT you choose. And the importance is not a generic thing like what are the recent advances, because that is like an exam question. But how can you make that recent advance yours? How can you own that space? Like, for instance, you become a master endoscopic surgeon. It doesn't matter if you don't know how to do a radical neck. If you can do endoscopy, you can enter practice as a super specialist very early. And if, say, I have a practice and I don't do endoscopy, I'd be more than happy to refer my cases to you or have you part of my group. If you want to join everything from scratch, you will forever be junior to somebody. So recent advances, Panchami, extremely important. Don't think of it as an exam question.
Super.
Thank you,
Dr.
sir.
Vidya, can you ask Anushree's question, please?
Yes, sir. This question is on behalf of Anushree. She have asked how to tackle thesis-related problems occurring in COVID pandemic.
Okay, so that's very easy. Number one, if you can't do the study because of COVID, you really have to reapply to the university saying, due to COVID, I can't do, can I do this? So you can pivot and change entirely. Many people understand the problem. See, all your examiners, all the people in the university, they are intelligent people, so they know. But let us assume you can do it, but your numbers have gone down. Then you just have to alter the statistical analysis. It could be by reduction of confidence limits. It could be by changing the endpoints. There are a variety of things you can do, but these are the two straightforward ways to address this question.
Wonderful.
Thank you, sir.
Thank you so much. Can I have Dr. Rinshin, please? Name, what level you are, your thesis topic, and your question. Dr. Rinshin.
Good morning, sir.
Hi, Rinshin.
Good morning, sir.
Yeah, good morning.
My question is, sir, how
No,
to
no, before
minimize
that,
confounding fact?
wait.
Yeah,
Where do you come from? What is your level and your thesis
yeah,
topic?
yeah. Yes, sir. Sorry, sir. So I'm Rinshin, first
Yeah,
year ENT PG,
yeah,
and I'm from Calicut, Kerala, sir.
okay.
And my thesis topic is the effect of ptericopalatine fossa in reducing the bleeding in the endoscopic nasal surgery, sir.
Okay.
Okay, sir. My question is, sir, how to minimize the confounding factors in a study, sir?
Okay. Just repeat the thesis topic.
Effect of ptericopalatine fossa blocking uh, um, in controlling the bleeding in the endoscopic nasal surgery, sir.
Okay, so this is a straightforward sort of topic because you just have to decide in the patients where you have done it and how much is. So the confounding factors usually in your case is you have to list the confounding factors. That is, you'll have to list the uh, things like bleeding parameters, vascular access, and any other uh, parameters which you have made out, and the final histopathology, the vascularity of the lesion, etc., etc.
Yes.
And I don't think you'll have enough numbers to make a statistical study of this, honestly. If you had big numbers, if you're doing some medical study, you'll have bigger numbers. Then you can apply statistics, regression analysis, you know, multifactorial analysis. But how many patients would you have? What is your planned patient numbers?
So my sample size is 22 each, sir.
Yeah, so see, when you list, most of them become obvious. You can, so this you do what is known as post hoc analysis. You don't do it beforehand. You do it at the end, and then you put it together. How many males? How many females? And don't get confounded by the word confounding factors in this case, because in any surgical observational study, all these things are not of statistical significance. See, confounding is a feature which you have to consider if you're looking at statistical significance. You will never be able to prove on 22 cases whether you recommend practice change, you know, what they call impact studies, whether it should be done or not. So what you have to do is, most important, you have to list the factors you felt could have played a role, so that subsequent studies can find out whether they are this thing. You should not concentrate on minimizing, you should concentrate on expressing all the potential confounding factors,
Yes.
whether it is surgical time, whether it is PT, APTT. So you list everything. If you have any enzyme levels, liver enzyme studies, if you had vitamin D levels studied, study every potential confounding you can think of and put it into your paper. So don't try to minimize, is my request to you in a study like this. List them, but you concentrate on the main ones. And where you have enough numbers, that the statistician can easily help you to say among all the factors, which is the one which is most important.
Yes.
You understand what I'm saying?
Yes. Yes, sir.
Right? So
Yes, sir.
suppose you have
Thank you.
15 factors, they can study all 15 and tell you that actually sex was the major issue. So if you had treated it as confounding and tried to hide it under the carpet, you would never find that out.
Yes, sir.
Okay?
Thank you, sir. Thank you.
Thank you, Vishnu.
Super. May I ask Dr. Poojitha for your question, please? Poojitha, your name, where you come from, what level, and your thesis before
Okay,
you
sir.
ask your question.
Yes, sir. Good morning, sir. I'm Poojitha, first year postgraduate. I'm from Bangalore, sir. My thesis topic is effectiveness of submucosal turbinoplasty in cases of refractory allergic rhinitis, sir. So my question is, sir, since it's an interventional study, what are the key points to remember prior to starting an interventional study, sir?
Okay, so I would argue whether this is a purely interventional study. This is an observational study of an intervention.
Yes, sir.
There's a vast difference.
Okay, sir.
See, an interventional study would be either a new intervention or it would be comparisons of some two interventional studies, etc., etc. What you are doing is somebody is doing the surgery for defined indications. You are assessing benefit. So that is where you have to look at it in a different perspective. So this is of course not to be put into your thesis, but just for your understanding. What you are doing is you are auditing the results.
Yes, sir.
Okay, so don't think you're doing an interventional study. The intervention is being done by your professor. You are observing the results of an intervention study. you understood, no?
Yes,
You
sir.
get that difference.
Yes, sir. Yes, sir.
So if your question is regards to your study is not an intervention study it's an audit of an intervention. if your study is, if I go for an interventional study, what should I think of? Then there are research ethics issues. Is the study going to benefit the patient? Are there potential feedbacks? Legal issues. All those are actually issues which have to be considered with intervention studies. And that is why I don't want you to think of yours as an intervention, because that would actually scare off the reviewers of a thesis. So try to put in that word, observation of an intervention or audit of an intervention.
Sure, sir.
Yeah.
Yes, sir. Thank you so much, sir.
Thank you, Vidya.
Excellent. May I have Dr. Chithra, please?
Good morning, sir. This is Dr. Chithra, first year ENT PG. I'm from Bangalore, sir. My thesis topic is a study to compare objective and subjective findings in chronic rhinosinusitis, where I'll be comparing the DNE CT findings and the symptoms, sir. My question is, what are the other modalities that I can include in my study, sir, except CT?
I mean, from a subjective perspective, objective perspective, what perspective do you want additional?
Objective perspective, sir.
So, objective perspective, they could be, okay, so one is plain objective and the other is subjective objective. I'm thinking as I talk. See, you look for scores in the subjective space, because you get objective scores in subjective. Say, for instance, you look at smell, you look at snot. Are you aware of all these terms? SNOT and all that? Have you heard of that? Yes or no, Chithra? Chithra, can you hear
Chithra,
No,
me?
are
sir.
you there?
Yes, sir. Yes,
So
sir.
have you heard of snot scoring, SNOT?
No, sir.
Okay, you just Google what
Okay,
are the
sir.
objective scoring of subjective symptoms in the nose,
Okay, sir.
like ranging from quality of life, ranging from smell, all those things. There are defined, validated scorings for
Okay,
the
sir.
subjective region alone.
Okay, sir.
Even in CT scans, there are your Lund-Mackey's and all that kind of scoring systems. Correct?
Yes, sir. Yes, sir.
Generally, MRI and ultrasound and all this stuff are not recommended except for studies. And if you're looking only at sinusitis, CT is generally the gold standard.
Okay,
So
sir.
you can actually do the Lund-Mackey for each sinuses. So if you look at
Okay,
it this
sir.
way, you have a wide variety of things to analyze. You have, even in the subjective thing, it is not just symptomatology, it is scorings. So you'll have scoring
Yes, sir.
there, you'll have scoring here, and in your DNE, in each pass, you can make
You have it.
you make your own scoring system.
Okay, sir.
If you don't find a scoring system for a DNE, you make your own scoring system. It should be logical. Like, inflamed, you put as 3, slightly red and hyperemic, you put as 2, normal, you
Okay,
put
sir.
as 1, something like that. Because
Okay.
if you want to do an analysis, it is easier to do with numbers,
Mm. Okay, sir.
right? So
Okay.
I repeat, you can have objective scores for each of the modalities. You
Okay,
can
sir.
have your own scores. Keep it simple for things
Okay,
where
sir.
you don't find scoring systems.
Okay.
And there are many defined subjective scoring systems.
I'll see to it, sir.
Yeah.
Yes, sir. Thank you, sir.
Thank you, Vidya.
Very nice. May I have Dr. Rohan, please?
Good morning, sir.
Hi, Rohan.
I'm Dr. Rohan.
Yeah.
I'm from Bangalore. I'm a first year ENT PG. My thesis topic is a comparative study of voice pre and post phonatory exercises in male subjects, normal male subjects,
Okay.
taking into consideration the jitter shimmer values.
Yeah.
My question is, how are new drugs which are given released, how are they? How is the effect of the new drugs analyzed? When,
So it's not related to your thesis, or is it an area of
no,
interest?
sir.
Why did you ask this question?
Just
If
an
I
area
may
of interest, sir.
say? Okay, so
Just an area of interest, sir. Not
no,
really.
no, no, I'm not in any way minimizing it. Remember that if you can develop that area of interest, you will actually become far more wealthy than standard ENT surgeons because the largest money is in this area. So if you have some skill sets in that, keep it alive. Okay. So broadly, I mean, this is general reading. You would get this on a Google also, but broadly, before a drug is brought to humans, there's a large research angle to it. That is very fascinating, actually. People have got Nobel Prizes in that aspect. So, how you find a drug, because lots of drugs are serendipitous. Nowadays, you have 3D graphics where you look at various, I mean, if you read the history of the drugs, the vaccines against corona, it is because they already knew the structure of the virus and they focused on one aspect of that for which they had a protein moiety against. So a lot of the thing is done on the computer. And then you have animal studies. So you have these things known as pharmacokinetics and pharmacodynamics. Are you aware of those things?
Yes.
Pharmacokinetics is how the drug is affected by the body. And pharmacodynamics is how the body can affect the drug. So all those kind of things are a branch of study in its own. So even in ENT, if you start reading up about this as to, what happens to a drug when it is absorbed, what is the minimum concentration which reaches the ear. In fact, these are really great areas for study. For instance, you give pre-antibiotics to children and say you're doing a grommet insertion. You should think of testing the antibiotic level in the middle ear fluid. Then you know whether that antibiotic has reached that or it's gone waste. You understand what I'm saying?
Yes,
So
sir. Yes, sir. Yeah.
this is all fascinating questions which, if we didn't think of thesis as an imposition, you can actually put this all as super thesis topics. Once you hit clinical medicine, then of course you have phase 1, phase 2, phase 3 trials, which you know. Phase 1 is safety, phase 2 is efficacy, and phase 3 is establishing benefit over current drugs. And phase 4 is, of course, post-marketing. So these are all standard stuff. This info you'll get anywhere. But my pointer to you is keep this interest alive if you're interested. Someday down the road, you'll thank me for it. And you can give me a piece of the money you're making, okay?
Sure. Yes, sir. Thank you, sir.
Not at all, Vidya.
Wonderful. Professor Ravi, I have a few words to say.
No, don't tell me words. Can I just sort of talk to these boys for a little while?
One second. Professor Ravi, I have a deep regret, a deep, profound regret. This is an interview which I should have done with you months and months and years back. What an eye-opener it has been this morning. What a vast expanse of knowledge you have thrown to us. Wow, how many windows of inquisition you have opened up for us. We never knew very many of the dimensions that you explored and expatiated. It is indeed a privilege and honor, Dr. Ravi, to have you on our forum. I now kindly request you to give a few words of advice to my postgraduates on how to survive and excel as a postgraduate.
Okay, so now again, thank you, Devan. I think you're too kind. But let me just come to something which I like to tell every postgraduate. Let's focus only on thesis. I'm not talking about the rest. You have hands-on experience from a master. Dr. Devan can, build you up as people of character and good doctors. But there is a formula which I want all of you all to learn when you do your thesis. Remember that The first stage of the thesis, once your topic is isolated, is to do an exhaustive literature reading. Now, I cannot overemphasize the importance of doing a thorough literature reading, and nowadays it is so easy thanks to the internet. So you learn things like Mendeleev, Zotero, EndNote. I'm sure you can find out, or it can be taught to you. I'm sure Dr. Devan can arrange to have that taught to you, and start collecting literature. Even if there's a ton of literature and it takes up the space in your computer, no problem. Buy a hard drive and save it there. So the first thing is to do exhaustive literature support, literature reading before you start your study. The second thing is try to publish a paper on literature alone. Now, all of you, if I have say about 10 postgraduates in front of me, if you can submit 10 papers on literature review alone, so it has nothing to do with your thesis, it has to do with the literature reading. So somebody was talking about voice in adenotonsillectomy. If I'm an editor and I get a review article, current study on or current literature on voice change, I would be glad to publish it because it is a baseline which will be cited by anybody who wants to read articles. Because whenever you see review article, you're excited because you know you'll get a lot of referencing. So you will be benefiting the entire scientific community. So Devan, my request is you pressure all of them to write the review articles. Where it comes, I'm not bothered, but attempt to write a review article. All of you. The second is start writing your thesis from day one. Now, this is a very, very important point. So I repeat, the first point was extensive reviews, extensive referencing and review. The second point is start writing your thesis from day one. The mistake everybody makes is they are still, no, I am accumulating patients. I have to take 30 patients. I'm only at 10. That is the wrong way of going about it. You have to start writing the thesis. Now you will turn around and tell me, Dr. Ravi, you're talking nonsense because I have not done a study. How can I do a thesis? Go to any old thesis, open it. 80% of the thesis is written the moment your referencing is over. Anybody has a thesis in front? If you don't, I'll tell you. The front page is binding, which you pay the binder, he does it. It's nothing of yours. The next pages are title, which is already defined. The next page is your name and your guide's name, which is defined. The next is, I thank my dog, my cat, etc., which is already defined. Put it in. And lastly, I thank my patients. Nobody's interested. Nobody reads that. You have to put it. So put it now. Right? And now with soft copies, you don't have to do anything. The next part is part A. What is part A? It's basically literature reading, which you already done. So finish the part A, you can do it on day one. Then comes the real study. In the real study, aims, you already decided. Objectives, you already decided. Material and methods, already done. So you see what I'm saying now, you already reached 60 to 70% of your thesis is already complete. Day one, you're not touched the patient. And then you come to the write-up of results. Now you will ask me, I don't have a patient, how can I write results? You can write the results tables. That is, you write age distribution, sex distribution, voice analysis prior, jitter, shimmer, etc. Voice analysis after, jitter, shimmer, etc. And then the last part is analytics. That is, age, does age affect jitter, shimmer? Does bleeding affect jitter, shimmer? Does length of surgery affect jitter, shimmer? All these questions, and I've said this in bits and pieces to all of you. If you put it together, I've actually told you this. So you prepare this results column beforehand. Fine. But you will say, doctor, the most important thing is discussion. Agreed. So start the discussion. What do you mean by start the discussion? The first part of the discussion is an analysis of demographics. Like you can say, you've done your literature reading. So suppose there are 3 studies similar to this. So you start with your demographics. Let us assume all the children you operated were males. So you will start, each table should have a discussion. So suppose your table is male, female. You write, in my study, XYZ were males, right? Or since you don't know, you say so many males, so many females. And then below that you write, Bogranov, who studied it in Russia, had all males or all females, so and so. So you look at their demographics in relation to that table, put it in. So again, you are padding up your thesis on day 1 based on your references. If you do this exercise within 15 days, your thesis is complete except for your study. Then the second thing which you should learn is to do an interim analysis and presentation. Because in an interim analysis on your second year, you make a presentation to Dr. Devan and all the faculty, and they will immediately tell you, you should look at this, you should get input from so-and-so, etc., so that you can do quick mid-course corrections. Doesn't matter if you have not done it for everybody. You can be honest. So which brings me to my point again that I'll repeat, you do your referencing, try to get a publishing of the review. Second, you try to write up your thesis very early. Why do I say this? Because then when your study is over, the day you put your last patient in, your thesis is complete, barring paragraphs as to what are the implications of your study. Your time is saved. Too many people fail their exam because the last minute they're running around trying to complete their thesis. Don't make that mistake. The second point, or the third point, which I'd like to emphasize, the fourth right now, is that, okay, so let me give you an analogy. Let us assume you're a cook, okay, a chef, and you're, say, cooking chicken, and the chicken falls on the floor. Nobody's seeing you. Nobody's there to see you. You pick up the chicken from the floor and you put it in the dish. Even the dirt taste will not come because the curry will mask it. And people may be very proud of it. They may say, wonderful flavor, wonderful this. But if they offer it to you, would you eat it? I think it's very obvious. The answer is no. Why? Deep down, you know that this is not kosher. This is not the correct thing because it has fallen on the floor. This principle I want you to keep when you're doing a study. If you ask your seniors, have you published your thesis? A vast majority will tell you they have not. They will say, I was too busy, I got a job here, I went abroad, all nonsense. The only reason why they have not published is that deep down, they are not convinced that their study was kosher. Many of them would have fudged the figures. See, you know how honest you are. It's not for me to tell you. You know deep down. You may tell me you're honest, but you know what you are. So the last most important message I'm giving you, I'm not being moral. I'm being very, very practical. Please be honest. If you have done 2 cases, say 2 cases. Don't say 200. Why? Because 2 cases can be published. But 200 fake cases, you yourself will never publish it. It is akin to the chef eating his own food. You would never do it. So if there is a single message I want to put across to you, do not fudge figures. Why? You don't need to fudge figures. And if you don't fudge figures, you will carry that whatever dish you have cooked much more, much deeper. Because you are convinced of, so suppose you got a study which says staphylectomy is a useless surgery. If you have faked your results, you would never dare to bring it up into print. But assume that you have not faked. You will fight for it because you will go and tell your professor, Doesn't benefit the patient, doesn't benefit the patient. And if your professor is smart, he will say, why is it not benefited? Let's make a deeper dive. Let us do detailed analysis. Let us do this. And you will then push the frontiers of science. So I repeat, very extensive literature reading and publication. Start writing your thesis early. Do an interim presentation. And lastly, of course, be scrupulously honest.
Priceless nuggets of wisdom, Professor Ravi.
Thank you.
I have no words to thank you for this fantastic expose this morning. I am deeply indebted to you for sharing your vast wisdom with us. Is there any query from any of the 11 postgraduates to Professor Ravi? This is an opportunity you will not get. Decades of our friendship resulted in this fantastic interview. My God, what a morning it has been. Thank you, Professor Ravi, for all that you have shared with us. May God bless you and shower you with wealth, happiness, and kindness in all that you do in the future. May all my postgraduates give Professor Ravi a very big hand. Thank you so much, sir.
Thank you, Vidya. Thank you. Thank you, Devan, for the opportunity again. All the best to all the students, okay? All the best to you all.
Thank you.
You're lucky to have a professor like Professor Devan, remember that.
I am touched. Thank you. Thank you.
Thank you, Vidya.
Thank you.